I'm going to tell you everything you need to know about the Botox lip flip, what you need to know before you get it done, who are good candidates, how it works, what to expect, how long it lasts, should you get a Botox lip flip or lip filler or both, and the importance of personalization of treatment. I've known people who have gotten lip flips done and say it didn't work. This actually happened to me the first time I tried the Botox lip flip out. And I'm going to show you real patient results. Lip flips are awesome because they can make your upper lip area look more full without any filler. That's zero filler. And it's a very cost-effective treatment. Treatments usually range from around the low 80s or so to the low to mid hundreds or so dollars. And the reason that it's so much less expensive than other areas that we treat with Botox is because you don't need as many units. Let's talk about what a lip flip can do for you.
A lip flip helps to turn your upper lip cupid's bow area outward, making your upper lip more full and plump. It helps with decreasing upper lip lines, also known as smoker's lines, and it enhances your smile, especially in people whose upper lip gets lost like this when they smile. The lip flip can help prevent the upper lip from disappearing when you smile.
Let's go over what upper lip eversion versus inversion is.
Inversion means to turn inward like this. You really notice inversion, or turning inward, when smiling. Here's Jennifer Garner's upper lip, inverting here. When she smiles really hard, she loses her upper lip. It flips under. This is what inversion is, when your lip curls or flips inward. Eversion is when your lip turns more outward. When you do a lip flip, it helps to curl your lips outward, giving them a more youthful, baby-like feminine look. And the upper lip border of your lip looks fuller. It's very beautifying, especially when you smile. Let's review some celebrities whose lips really evert out so that you can get a better idea of what upper lip eversion is. Liv Tyler, daughter of Aerosmith, who's known for his full lips, passed this trait on to his daughter. Here you can see this nice, beautiful upper lip eversion, or the upper lip curling outwards. Gugu Mbatha Raw also has it. You can see a nice, full upper lip cupid's bow that turns outward. As does Julia Roberts. She's got it too. I'm sure you remember this movie, Pretty Woman, the bathroom scene where she's singing a Prince song. You can see when she smiles, she has a nice lip eversion. Kerry Washington has it too. She's got a nice curled out, beautiful upper lip that everts. As you can see, not everyone has this type of upper lip eversion. This is Ashley Simpson and Lily Sobieski back in the day. And if you're saying to yourself, well, these women's lips are just smaller, it's not about the size, it's about the shape. The eversion versus inversion, or turning in or out. Later on, I'm going to show you a patient I treated whose lips were close to the same size as these women's here, and she got a nice eversion and fuller upper lip after her lip flip. Lip eversion, or curling outwards, definitely reduces with time because our lips lose volume and deflate as we get older.
How does it work?
When we do a Botox lip flip, we are treating this muscle here called the orbicularis oris. This muscle is a circular ring or sphincter muscle that encircles our mouths. It's also known as the kissing muscle because it allows us to pucker our lips, close our mouths, and push our lips forward, and do everything from spitting out sunflower seeds to playing musical instruments such as the flute. Compared to other muscles we treat with Botox, this is a very active and strong muscle.
When you do Botox or any other neuromodulator to this muscle, it'll help relax it, helping it to evert and flipping your upper lip more outward. If you have lip lines, they're going to show more when you pucker. It helps reduce them, and
it really enhances your smile because when you smile, it helps to keep your lip everted so that your upper lip looks more full and plump.
Lip flip versus lip filler are two totally different things.
When you do lip filler, you are using a hyaluronic acid gel substance to directly add volume to your lips, in which both your upper lip and your lower lip will be volumized or enlarged.
It's more expensive, it lasts longer, but it also comes with more potential complications like vascular occlusion, which is a complication that can happen anytime you do filler for that matter.
On the other hand, when you do a lip flip, you're utilizing a neuromodulator like Botox or Dysport to weaken the muscle that surrounds your lips to help make the upper lip look more full.
Who are good candidates for a lip flip? Anyone who wants to evert their upper lip and enhance their cupid's bow, but if you already have upper lip eversion, then you probably don't need it. It's great for somebody who just wants that little extra something, that little extra fullness to their top lip. If you're not quite ready for lip filler yet, and you're overall happy with the size of your lips, and you want that little extra pop, you may want to try the lip flip. Remember, it's going to enhance your upper lip as opposed to your upper and lower lip. If you're someone who loses your upper lip when you smile and you want to try to prevent your upper lip from disappearing when you smile, I'd definitely try this. It works really well for this. If you want to decrease your upper lip lines, a lot of times when we talk and we use the words with the vowel O, we can see those lines. It's not just when we intentionally make the pucker face. I tell my patients that if you're not quite ready for lip filler, but you're overall happy with the size of your lips, then I would give the lip flip a try. But if you're not that happy with the size of your lips and you feel that enlarging your lips will enhance your beauty, then try lip filler or try both. I actually have a lot of patients that do both. They do lip flips in between their lip filler treatments to give them that little extra fullness. It gives them a really nice enhancement that they can do in between their lip filler treatments, and it kind of helps to hold them over, and it gives them something to look forward to in between their lip filler treatments. I tell my patients that this is an area that you're going to feel the Botox. Compared to other areas that we treat with Botox, this muscle is very strong, therefore you're going to kind of feel that weakening effect. I like that feeling because when I would get nervous, I held a lot of tension here, so it really helped to kind of reduce the tension.
After the lip flip, it could be harder to whistle. I can still whistle fine, it just feels different. It feels weaker, harder to hold mouthwash. Some people say it's more challenging using a straw. Again, anytime you make the words with the vowels O, in which you have to purse your lips together, you can feel it, but most of the time after many treatments, you don't feel it as much and you get used to it.
Keep in mind, if you play a musical instrument like the flute, the trumpet, if you're a vocalist for a living, if you snorkel, if you scuba dive, it could be harder to make a seal. The feeling takes time to get used to, and most people are not bothered by it. But I've had a few people who say they don't like that feeling, and if that's the case, they just opt out for future lip flip treatments. It is very short-lived compared to other areas that we treat with Botox. So if you don't like that feeling, it'll go away in a few weeks. And yes, I just have to address this because I've gotten this question many times before from my female clients. Will it be harder to engage in certain oral activities? You'll be fine. I have very full lips naturally, and I have never done lip filler, despite the comments I receive on YouTube. The first time I tried the Botox lip flip out, I used the same amount of units that I saw the dermatologist that I worked for at the time treat her patients with, but I saw no result, nothing. I thought lip flips didn't work.
Then months later, I thought to myself that maybe the reason why it didn't work is because there was a difference between my anatomy versus the anatomy of most of the patients that the dermatologist used to treat, and therefore I needed to try a higher dosage.
When I changed up the dosage, increased the units, I saw results, and I fell head over heels in love with the lip flip, and I still do it to this day. It really helped enhance the shape of my lips and made my upper lip look more full and enhanced my smile. This brings us to the topic of personalization and why it's so important. I've had patients come to me and say they tried the lip flip with someone else and they didn't see results. And then I ask them, how many units were you treated with? And then when I find out how many units they were treated with, I tell them, let me give it a try. And most of the time when we give it a try, we're successful and they fall in love with it. So if you've tried the lip flip and you didn't see results, it could be because you weren't treated with the right amount of units. It could be because you weren't treated in the right area. This brings us to the important topic of personalization and your genetic ancestry.
In general, if you have small lips and a small mouth, then you won't need as many units of Botox for a lip flip. If you have larger lips and more tissue density, then you'll need more units of Botox. Generally speaking, people of European descent have thinner lips and smaller mouths with thinner and more delicate tissue surrounding their mouth or perioral area, and therefore may not require as many units. Also, I've had patients who have smaller lips with less tissue density around the mouth say to me, I specifically avoided using straws and smoking, and I still developed upper lip wrinkles. Or, I have smoker's lines, but I never smoked. And the thing is, you could have avoided all of these activities and you could still develop these lines because everyone loses collagen and elastin as they age. And if you're someone who has a smaller mouth and lips and starting with less tissue density than someone who has more fullness and thicker tissue density to the mouth or perioral area, then you'd be more likely to develop those lines. This does tend to be genetic. People of sub-Saharan African ancestry, especially West African and Southern African ancestry, and some East Asian and especially Southeast Asian ancestries usually have larger lips with more tissue density, which tend to protrude outward due to more soft tissue mass or volume. They'll generally need more units, but I've also had some people of European ancestry who also need more units because they have larger lips, stronger muscles, and more tissue density. So these are just generalizations based on ancestry.
Everyone is different and unique. No face is the same. Therefore, I personalize treatment with every single patient. Let's go over some lip flip pros and cons. It's cheap because it doesn't require that many units compared to other areas that we treat with Botox. Treatments usually cost anywhere from $80 something to $160 or so dollars. It doesn't last as long as other areas that we treat with Botox, and that's because the muscle is so strong and we use it so frequently. It usually lasts around 4 to 6 weeks. However, with time and consistency, that muscle gets trained so that you don't need to get treated as frequently. As a matter of fact, I had a patient who lost her upper lip when she smiled. I started her on the Botox lip flip and she fell in love with it. So she was pretty consistent, coming to me, I would say every 2 months or so for a total of around 2 years. And then when COVID hit and I couldn't see her for a long time, when she came back in, her upper lip never went back to baseline. It never went back to disappearing when she smiled like it did before. So I think it definitely does train the muscle with time, so you don't need to get treated as frequently. So let's look at some real patient results.
This patient's lips are smaller and a similar size to Ashley Simpson's that we saw before. You can see after her lip flip that she's fuller to the center and on the sides of her upper lip, which makes her lips look more full overall. Also observe that her upper lip lines are pretty much gone when she makes the poker face. This lovely patient wanted to get her lips done, and because she has full lips and a nice lip size, I advised her to try the lip flip instead, and she fell in love with it. You can see she got a lot more fullness to her upper lip, which makes her overall lips look more voluminous and plump. And as with all lip flips, it also enhanced her smile. This patient already had filler to her lips, and she wanted to get a little more fullness and a little extra enhancement. So I suggested we try the lip flip, and as you can see, after she has a fuller, more defined Cupid's bow and a better shape to her top lip in general. She was hooked after. This patient was contemplating getting lip filler, and she's a good candidate for it, but she just didn't want to go there quite yet. I told her let's try the lip flip first. She was really bothered by her upper lip being thinner and getting lost like this when she smiles, especially on the sides. After her lip flip, it made a really big difference in giving her a lot more volume. And take a look at how her lip doesn't invert as much when she smiles. It also prevents her gums from showing in comparison to before. This is another example of how the lip flip can help to enhance your smile. Also, if we look at her 45-degree angle picture, you can see how much it reduces the space in between the base of her nose to her upper lip. This area plays a big role in beautifying your face, which is why surgical lip lifts are so popular. They really make a big difference in enhancing someone's beauty and giving a more youthful, feminine look, because having too much space from the base of your nose to the upper lip can elongate the face and give an aged look. In addition, it reduced the subtle lines she had when she puckered. She was very happy with the results and doesn't feel the need for lip filler anymore.
I hope you enjoyed this video. Please like this video, subscribe to this channel, share this video with your friends. Let me know what you think. Would you try the Botox lip flip? Have you tried the Botox lip flip? Leave a comment or question in the comment section.